So you want to get accepted into PT school and become an amazing physical therapist. You want to help change lives, work with athletes, and help quality of life become elevated and just way better with your help. And that's absolutely amazing. And I applaud you for choosing this path towards physical therapy. However, every profession always has a shadow side. And we talk a lot about the positive stuff of being a physical therapist and being in PT school, but what about the negatives? So in this video, we're going to be talking about the 7 different reasons why you should not become a physical therapist. Physical therapy school tuition. The amount of requirements, constantly selling physical therapy, poor customer service skills, difficulty working with others, demanding work, having an active lifestyle. Let's get into this. Lego. Hey everyone, what's going on? My name is Dr. LIFTFORCHANGE, Justin Lee, physical therapist. I'm a high-performing physical therapy student coach, and I help students get accepted into physical therapy school. And once you're in, I coach students to live abundantly and intentionally through the physical therapy school experience. So if any of that resonates with you, feel free to watch the other videos on my channel and comment below on that video and say hello, or if you have any questions, feel free to comment. I always reply to everyone on my channel, so I'd love to connect with you. Okay, so we're gonna get started on the 7 reasons why you should not become a physical therapist. As I've been working as a PT, I've learned a lot of things throughout my career. I've learned so many great things and so many not so great things, and I've witnessed people, students, drop out of physical therapy school or just step away from the profession as a whole. So in this video, I'm gonna give you the 7 reasons why. So let's get into it. We're gonna start with number 1. Physical therapy school tuition. Now, as you know, tuition is a lot. Like on average, public school education, you might be able to get it for $30,000 to $50,000, but that's a rare case because it's so competitive. You gotta expect that you're gonna go into a private school institution or program and expect to pay at least $100,000 to $110,000 in tuition alone. Yeah, so you gotta think about that and have the expectation that you're gonna be paying that much money for student loans or student or school tuition. And you know, if financially it's probably not the best investment. Now, I'm no financial expert, but you know, spending $110,000 to be in student loan debt and making starting about $60,000 to $80,000, the payout doesn't pay that well. So if you're all about the money and you're trying to think about what can I invest in, what would be a good financial investment, I don't think physical therapy school is gonna be your answer. I would probably put that closer to the bottom of the list. But if you're looking for a very fulfilling career and all those positive effects that we're not talking about in this video, physical therapy is a great profession. Hey, I live a great life and I love my job. Okay, number 2. The amount of requirements and academics that you need to get into PT school. Now I get it. Not everyone has the intellectual ability to handle physical therapy school, and as you're fulfilling your prerequisites, you will already get that idea of, hey, you know what, maybe science isn't for me. I tried really hard on biology, chemistry, anatomy, and I just can't get it. I just get C's, D's, I gave it my best shot, but it just isn't for me. Hey, you know what? That's totally normal. There are a lot of students who choose this path towards physical therapy, try to get all those requirements in, and just realize it's just way too much. I mean, you are already thinking about, you have your undergraduate and you're probably gonna spend 1 to 3 additional years just trying to get all your requirements ready. And then when you get into PT school, you have to commit 3 years of your time. Are you willing to commit your time, energy, and focus throughout that time so that you could become a physical therapist? Okay, we're gonna go into number 3. So the first two, we were talking about things about PT school and all the stuff trying to get into school. But now let's talk about the actual work as a physical therapist. So number 3 is that you're constantly selling physical therapy. Now, I don't know about you, but when I first started physical therapy, I did not like to sell physical therapy. And I didn't realize that it was a profession that demanded so much selling, so much convincing. For example, check this out. A patient walks in, says they're hurting, comes to you like, physical therapy, that's like some voodoo stuff. Like who knows what you're doing? Like, I don't get an instant fix, I don't get any medication, I don't get any shots or surgery. How do you know you are doing something to me? Right? So a lot of people come into therapy with this negative and skeptic thought already. So you as a physical therapist really have to try to convince, try to influence, and try to help the patient see the value of what physical therapy can do for their pain, for their illness, for their limitations, and for their life. Of course, as a physical therapist, I know that we can help all people in the world improve their quality of life, but a lot of people don't necessarily agree with that, especially patients, and especially when they're in pain and super irritable. So every single session, not even the first session, the second session, the third session, you always have to remind the patient why they need physical therapy. You have to resell the patient, resell the patient, resell the patient. And that could be exhausting. So if you're the type that like doesn't really like to talk and convince people, and you just kind of like to stay sheltered a little bit, you'll have a lot of resistance when you become a physical therapist. Because check this out. Let's say you don't sell physical therapy and you just like, patients come in, you just do their thing, you just do your thing, and then they leave. If they are not convinced that they need you or they need physical therapy services, they're not gonna come back, period. All right, that's the reality of it. So then you're there at 8 a.m., you drove an hour in traffic waiting for this patient. 8 a.m. comes, patient's not there. 8:10 comes, patient's not there. Guess what? The patient just no-showed you because they realized that they don't need you, and then you don't get paid for that hour because your job won't pay you if you don't have a patient. Okay? So you can see how this plays out, and you can see how the importance of selling physical therapy is huge, okay? And the high-performing therapists that are doing the best are excellent at selling physical therapy. So along with selling physical therapy and trying to convince them and just really having that relationship with people, that brings me to number 4, is that if you have poor customer service skills, that is a huge reason why you should not become a physical therapist. In school, I learned all the clinical skills, right? All the stuff that I need to do to work as a physical therapist, the actual tactical skills, like going to trade school or something. But what I didn't know is when I started to work as a physical therapist, almost 80% of the whole profession is about customer service. You're being with people one-on-one, or you're connecting with them and you're having a relationship with them. You're conversing with them, you're learning about their life, learning about their pain, about everything in their life. You have to connect with people. And if you are impatient and you're not a good listener, right? If you are someone who just is like really quick to anger, really quick to be angry and just get frustrated easily, like if patients are here and they're in pain and they're just constantly talking, and you don't have a chance to really do your job, that could be pretty frustrating. But you have to, as a PT, hold your tongue and kind of step back and listen. You know, you have to go above and beyond for these patients and make them feel valued, make them feel like they're wanted. And it goes to show again, if they don't feel those things, if there's poor customer service, they are not coming back. If they are not coming back, you're not getting paid, this keeps going over and over, you're gonna get written up and eventually you're gonna get fired because you cannot produce as a physical therapist. Now, these are some skills that you will learn as you continue to practice PT. But if you already know, you know what, customer service and talking to people, that's just not my thing. It's just so draining for me. I'd rather just like not talk and just be in front of a computer. If that's you, that is a huge reason for you to not be a physical therapist. Number 5 on the list. If you have a lot of difficulty working with others, that is another reason why you should not become a physical therapist. Chances are when you first start working as a physical therapist and just get experience, you are not going to be opening up your own practice. Now, it does happen, but it's very rare. Chances are you're going to be working with other people, working with a staff, working with other physical therapists, working in a clinic. You have to be able to communicate. You have to be able to be nice and friendly to all your coworkers in a professional setting. And if you can't do those things, then it's gonna make your job really, really, really hard, and everyone in the clinic is not going to like you. As a physical therapist, there's a gym, right? And several tables typically, and everyone, the whole staff, the whole clinic shares those equipments. And so you have to obviously converse with people. There's gonna be separate rooms and you might need a room. You're gonna have to talk to people and say, hey, I need a room, and ask for favors and do stuff for other people. And if that's just not you, if you're just like, I just don't like to work with people, and I'm just not really good when I'm working. I just turn into a different person. I'm not really social and I'm kind of standoff. That's a good reason why you shouldn't be a physical therapist. PTs, if you haven't gotten this already, PTs are very social people. They love to interact, they love to make connections, they love to have relationships. And you guys know this from watching this channel that I harp and I preach this all the time. But it is imperative that you understand this. It is absolutely necessary as a physical therapist to have these characteristics. And if you don't, then you're SOL, my friend. This is not a good sign for you. And if from the list already, we just went to number 5. If already on the list, you're already picking 3, maybe these next 2, you're gonna be like, oh, that's me. I would really reconsider your profession. Now, just a little sidebar here. If you are considering, hey, PT or another healthcare profession, like a nurse, a chiropractor, a physician's assistant, whatever that may be, I have a video playlist on this YouTube channel that compares physical therapy and a different healthcare profession so that you can compare and contrast and see if you can make the decision as to if you want to be a PT or not. Shameless plug, y'all. Guys, I really try really hard in this channel to make content that is relevant for you as a pre-physical therapy student or as a PT student. And so if this healthcare comparison between PT and another profession works well with you and you're like, this is super valuable, I'd really appreciate it if you comment below and share some feedback with me in one of those videos or in this video if you found value in it, because I really cherish that and that means a lot to me and I learn from everything that you guys say. All right, we're gonna get into the next one, number 6, and this is gonna be demanding work. Now, this is the actual work of a physical therapist, right? Like, when you clock in, your job doesn't start. Your job starts 30 to 15 minutes before you clock in, because you gotta go over your caseload. You have to see what patients you're going to see that day, what the plan is, and try to anticipate what types of treatments you're going to give. So you are already starting 15 to 30 minutes before your work, and then you have your whole shift. That might be an 8-hour shift, 10-hour shift, 12-hour shift, whatever that may be. But you're working around the clock over and over and over again, because when the profession of physical therapy is a service-based profession, right? So there are appointments. It's not walk-in. And so you don't really have open time throughout the day. You're treating a patient from 8 to 8:20, and you go to another patient 8:20 to 8:40, and then 8:40 to 9, and you keep repeating that process over and over throughout the day. It can get exhausting. Let's say you see 2 patients a day, 2 patients per hour. You have a 10-hour shift. That is 20 patients, 20 different people that you are talking to, investing into, just being really attentive with your listening. It's a lot of work, right? You go to a baby shower or a wedding and you talk to like 5 people and you're like, oh, when you come home. Imagine doing that every single day. Now check this out, I'm not done yet, y'all, because after you're done with work, as you guys know, documentation. Oh, heck no. Documentation is the worst part of being a physical therapist, and you better believe that after you're done with work, you're taking documentation home, especially when you first start working. Now, as you gain experience, you get better and better and more efficient and productive, and you can maybe not take documentation home, but chances are you're gonna take it home. So here we go, let's recap. 15 to 30 minutes before your shift, not getting paid. Then you have your 10-hour day, seeing at least 2 patients an hour. And then after your 10-hour shift and seeing 20 people, you go home and you document all 20 people. Now, let's just say each documentation takes about 5 to 10 minutes, which is pretty average, right? 20 people, that's 200 minutes. Oh my gosh, that means you're spending several hours after your job on Monday, then Tuesday, then Wednesday, then Thursday. Oh my. Guys, you guys catch my drift here? So this is real talk, and I'm super serious here. I've seen my friends, I've seen my colleagues get out of the profession because of this demanding work. It's a lot. And that's why the rate of burnout is so high in physical therapy. And that's why it's so important to protect your well-being, your mind, your spirit, right? Your body. All those things are absolutely important. Number 7, and that is having an active lifestyle. Now, live for change, right? That's what we're all about in this channel. Now, as a physical therapist, you got to live an active lifestyle. This is what you're preaching. This is the medication. This is the treatment that you're giving, right? And if you are not practicing what you're preaching, how do you expect your patients or your followers to actually listen and be influenced by you? If you see a dentist that has crazy teeth where their tongue looks like it's in jail, would you go to that dentist? If you want to lose weight but you see a dietitian that is overweight, would you want to get advice from that person? If you see a doctor that smokes, that drinks, that does all these bad healthy habits, would you want to have that person as your doctor, your primary care physician? Absolutely not. And there's no shame in being overweight, and there's no shame in all that stuff. But it's just the way it is. This is the profession that we are in. And if you are not living an active lifestyle, if you're not exercising, if you're not moving around and practicing that, then how do you expect the people that you're talking to actually listen to you? Okay, one more example. If you have acne, like me, and you want to go to a dermatologist, and that dermatologist has like poor skin, scaly, flaky, bunch of acne, bunch of stuff, you would not see that person because you go, dude, this person doesn't even take care of themselves. How would they take care of me? So having an active lifestyle as a physical therapist is going to be huge. And if you cannot commit to living an active lifestyle, if you cannot commit to moving around a little bit more to try to understand the patient of what they're going through and just be the person that you're actually preaching, that's a huge no. That's a no. All right. So we went over the 7 reasons why you should not become a physical therapist. And I hope this video helped inspire you to maybe open up your eyes and unfortunately turn away from this profession. And if that's the case, I totally get it. But remember, I do have videos that compare PT and other healthcare professions, so please feel free to check that out. Also, you guys, before you go, please feel free to connect with me. You can find me on Instagram and the Levator Nation Facebook group. I talk about everything related to physical therapy and the physical therapy school application in the Levator Nation group, and we go live every single Tuesday. And on my Instagram, you can follow me and see what my life's about. See my beautiful wife, my pregnant wife, and my baby that's coming, and just so many things. Now, if you are having trouble trying to get into PT school and you're just so confused and overwhelmed, I do have an online course that teaches you everything you need to know to get accepted into physical therapy school, and that course is on the link below. So many students have found that video or found the videos in the course to be super helpful, and they were actually able to get accepted into physical therapy school while using the course. So I'm so excited to help you get accepted and become a future doctor. Guys, remember, every day is a great day to lift weights, lift each other, and lift yourself up. Stay lifting, stay aloha, God bless. Have a great one, you guys.